Assalamu alaikum wa rahmatullah. Nice to meet you again. Another topic in orthopedic surgery, bone tumors, part 1. In this presentation, we will see the most common bone tumors in the human body, but bone tumors are in generally very rare. So bone tumors are rare. They are maybe 1% of all tumors, often overlooked, misdiagnosed, or sometimes neglected. 60% of the primary bone tumors occur in pre-puberty age, while the secondary tumors are in adult age. There are benign and malignant tumors. Now to the classification of bone tumors, we have benign and malignant tumors. Benign tumors affecting cartilage tissue as osteochondroma or chondroma or chondroblastoma. Benign tumors can affect also bone tissues like osteoma, osteoid osteoma, and osteoblastoma. They can affect connective tissue as fibroma, or affecting fat tissue as osteolipoma. Benign tumor can affect muscle tissue as leiomyoma, or vessels as bone hemangioma. Also, the malignant bone tumors can affect cartilage tissue like chondrosarcomas, or can affect bone tissue like osteosarcoma, or can affect also connective tissue like fibrosarcoma, and fat tissue like liposarcoma, bone marrow like plasmacytoma and Ewing sarcoma, and can affect also vessels like bone hemangiosarcoma. Bone tumors may arise from three sources, either from osseous tissue or cartilage cells, or from blood forming elements in the bone marrow. So the first source, from the bone tissue itself in the region of diaphysis or metaphysis of the bone. The second one is the cartilage tissue or cartilage cell bone tumors. It means from the epiphysis, or from the bone marrow, means from the red bone marrow, blood forming elements. In the X-ray finding, we find radiological changes typical for malignant or benign tumors. For malignant tumors, on the left side, three figures, either osteolytic lesions or medullary defect or penetrations. In case of benign tumor, we find sclerosis. We don't find a damage of the bone like in the malignant tumors, but we find sclerosis, typical sclerosis of the bone. This picture demonstrates the differentiation of almost all bone tumors, benign and malignant bone tumors. So here we find, or we see two patients with the head bone tumor almost of the maxillary bone, either malignant or benign. So now in some details. The first what we see is the simple bone cyst. It is a benign bone tumor affecting the childhood age or very young adult age, mostly affecting the metaphysis of long bones, often by chance. So we see this in the X-ray without any symptoms, or sometimes after pathological fracture. It means the simple bone cyst was happening long time before the pathological fracture was happening. And here two examples of simple bone cysts. On the left side we see a simple bone cyst. It means benign bone tumor on the upper part of the femoral shaft. It is one room, one camera, isolated, and on the right side we find the simple bone cyst with pathological fracture in the humeral bone near the shoulder joint. In comparison to the simple bone cyst, we find the aneurysmal bone cyst. It is more affecting the older children and adults, usually in the long bone or vertebrae in the spine. And we find here a very thin bony shell as demonstrated in this X-ray view, because it contains of blood inside the cyst. If we open this cyst surgically, we find blood inside the cyst. Here examples of aneurysmal bone cyst or hemorrhage bone cyst. The region is different, maybe in the distal tibia near the ankle joint, or in the distal femur near the knee joint. We find many rooms at the same time, not only one cyst but also small areas damaged together. And here examples of bone cyst with complications. The most complication type is the fracture, pathological fracture. And on the right side we see the surgical treatment, means the amputation of the bone, excision of the bone, correction with this is the external fixator on the distal and proximal part of the bone, in this case the femur of the child, and the excision of the tumor. It's, as we know, a benign tumor. And here we find, or we see, the filling with bone marrow, and later on the sclerosis and the bone tissue, new bone formation. So here we find another type of benign bone tumor, which is the osteochondroma, or we can call the exostosis. The exostosis is arising from the epiphyseal cells, from the epiphyseal region, which is the black line near the end of the bone, near the joint. This is the epiphyseal plate. May be solitary or multiple. Sometimes we find only one osteochondroma, only one exostosis, sometimes multiple, many exostosis. The complications of this type of bone tumor is compression. It can cause compression on a nerve or a blood vessel, which is can cause painful compression, or it can lead to fracture, pathological fracture. Sometimes it can be malignant. It can change to malignancy, which is very rare. This X-ray view shows osteochondroma, single. It means solitary. One osteochondroma affecting the distal medial aspect of the femur. How we know that it is the medial aspect? If we see the knee joint, we find the fibula on the other side of the joint, of the knee joint, and the osteochondroma is on the medial aspect. And here also multiple osteochondroma affecting the leg is demonstrated. We see the clinical picture on the left side. On the right side we see the X-ray view of this patient with multiple osteochondroma affecting both legs. This picture demonstrates multiple enchondroma of left hand in comparison with the right hand. The right hand is clear, is not affected. The left hand is affected with multiple enchondroma, as you see in multiple fingers. So next time we will continue to talk about bone tumors. Thank you. Bye bye.